Hi, my name is Habtamu Gebresenbet. Today I am going to present about the HIV outbreak around 1980s. The origin of HIV has been a subject of scientific research and debate since the virus was identified in 1980s. People sometimes say that the HIV started in 1980s in the United States of America, but in fact, this was just when the people first became aware of HIV, and it was officially recognized as a new health condition. Introduction. HIV/AIDS refer to a range of conditions that are caused by infection with human immunodeficiency virus. The HIV virus infects vital organs and cells of human immune systems. The progression of the virus varies significantly among the patient and depends on several factors, such as age, ability of the body to fight the virus, ease of access to medical care, and genetic inheritance of an individual. It may not be easy to tell the signs and the symptoms following the initial infections. Some of the common symptoms of early HIV infection may include fever, chills, red rash, and tiredness. However, such symptoms are likely to appear when the immune system is combating several strains of virus. Late-stage signs of infection include diarrhea, dry cough, and night sweats. It's widely believed that the infection originated in the Democratic Republic of Congo. Documented cases of AIDS in the United States point that there were a rare case of the infection prior to the 1970s. Available data suggests that the current epidemic started in the late 1970s. Notably, in 1982, there were several cases of infection among gay men in the South Carolina. Such developments point out that the cause of immune deficiency was sexual. The, the disease was later reported among hemophiliac and Asian peoples. Today, in the United States, 1.2 million people live with an HIV infection, of whom 50% are unaware of their infection. Methods. Public health surveillance. Public health surveillance was the key in establishing the cases of HIV/AIDS. The cases were reported in European countries in 1980s. Notably, in Uganda, the doctor made public cases of a new and fatal wasting disease. It was at that point that a number of AIDS-specific organizations were established, such include the San Francisco AIDS Foundation. The disease was common among the gay men. It was also reported among the female partner of gay men who had the disease. Such development led to the perception that the disease could be spread through heterosexual sex. Gay men and their female partner formed the initial sample of population for the study on the disease. It was in June 1983 that the first case of AIDS in the children were reported. Such development hinted that the disease could be spread through casual contact. It was perceived that the disease was acquired from their mother during and after birth. However, such development could be ruled out as Children formed part of the sample of population for the study on HIV/AIDS. The result of the study pointed out modes of HIV transmission and ruled out the likelihood of the transmission by unintentional contact, food, or air. The first recommendations for healthcare workers were later on published to assist with the prevention of HIV transmission. This figure explains estimated AIDS incidence, deaths, and prevalence in the United States between 1981 to 2000. As we see in the figure, AIDS incidence increased rapidly through the 1980s, peaked in the early 1990s, and then declined. The peak of new diagnoses was associated with the expansion of AIDS surveillance case definition in the 1993. As of, as of 1996, sharp decline were reported in AIDS incidence and deaths. From 1998 through 2000, AIDS incidence and death level off and the AIDS prevalence continues to increase. This figure explains the number of AIDS cases among men who have sex with men, injection drug users, and persons exposed through heterosexual contact in the United States between 1981 to 2000. As we see in the figure, male-to-male sex has been the most common mode of exposure among the persons reported with AIDS, followed by injection drug users and, and then heterosexual contact. The incidence of AIDS increased rapidly all three of those risk categories through the mid-1990s. However, since 1996, decline in new AIDS cases have been higher among male-to-male sex and injection drug users than among the person exposed through heterosexual contact. Method. The second method is a laboratory. Laboratory methods were utilized in the study of HIV/AIDS. The first test approved by FDA was ELISA test. The test is still in use today as it includes a number of updates incorporate the development in research for HIV/AIDS. Early laboratory methods also carry out DNA and RNA tests to discern the HIV status. The DNA test would measure the amount of genetic material that belonged to HIV in the body. Urine tests were also prevalent in the late 1980s. Advance in research on HIV/AIDS developed the vital case definition for an individual with HIV/AIDS. It was required that for an individual to be diagnosed with AIDS, they were required to have a condition defining AIDS according to CDC. Notably, such individuals were anticipated to have a CD4 count less than 200 cells per millimeter squares. Initial EPI results pointed out that the transmission rate of HIV/AIDS was relatively high among hemophilics. It was also high among homosexual, heroin users, people from Haiti. Developments in research would point out that females could also get HIV through sex. It would be clear that there were more than 3,000 diagnosis cases of people with AIDS in the United States. Half of those diagnosed with AIDS died. AIDS would become the leading cause of death among adults aged between 24 to 55 years. By 1995, about 50,000 American dead of AIDS were African American, were about 49%. However, the deaths related to HIV/AIDS began to decline following the multiple therapies for the condition. Notably, the deaths dropped from 38,780 in 1996 to 14,000 in 2000. This chart adapted from FDA.gov, and this chart includes the deaths for all ages, race, and both genders. Through the AIDS epidemic began around 1979, the data on the deaths were unreliable until 1987. As you see in the figures, the number of AIDS cases increased rapidly up from 1987 to 1995 and then decline rapidly after that. Control techniques. The government took a number of measures to assist in containing the spread of HIV. Such include funding research geared toward medical treatment of the condition. The government also imposed travel restrictions aimed at mitigating the spread of the disease. There was a strict entry for the people with HIV/AIDS in the United States. Conclusion. The history of HIV/AIDS epidemic began in illness, fear, and death as the world faced a new unknown virus. However, scientific advances such as the development of antiretroviral drugs have enabled people with access to treatment to live longer and healthier lives with HIV. HIV today is considered as is not a killer disease. It's just considered as a chronic disease. In addition, the research on HIV/AIDS was paramount. Notably, the government supported research initiative on HIV/AIDS. The research ruled out some of the common myths and misconceptions about HIV/AIDS. There was high level of accuracy in healthy investigation. Such result in significant result management of HIV/AIDS. This is my reference, and thank you for listening to me. You have a nice day.